Hi guys, Dr. Sandhu from iMedics. This morning's video is a short video on how to interpret a microcytic anemia on a blood test. So essentially, it's when you get a low MCV and a low hemoglobin. Now, this is a good learning point because the commonest thing that most of us will do, both in clinical practice when we're looking at blood test results in primary care or secondary care, and also in your exam questions, is that people will go for iron deficiency anemia as their main cause. But there are two other things that you should be mindful of. So let's get started. The first thing is that, of course, you've got the low MCV, you've got the low hemoglobin. You should check the ferritin level. Of course, if that is low, then we know we're dealing with an iron deficiency anemia. And the nice guidance would say you start them on iron supplementation. You check the levels in 2 to 4 weeks. If there is a good response, you can check the levels again in 2 to 4 months. However, if there's not a good response, there's two things that you need to be thinking about. So the second thing is thalassemia. And that's when you get an MCV that's just too low in relation to the hemoglobin that's been recorded. And this is more common in patients from sort of the Far East or from Mediterranean backgrounds. And the third thing, this is a rarer cause, but you can see it in clinical practice. Up to about 15 to 20% of people can have this. And this is a condition called Pseudoplastic anemia. And that's when you get this classic microcytic anemia, i.e. a low MCV and a low hemoglobin, but it's not responding to iron treatment. And what you'll find is that in terms of sideroblastic anemia, is this is a condition where the body produces enough iron, but it doesn't bind onto the hemoglobin. So you get lots of iron in the body, and it starts to mimic the picture that you get with a iron deficiency anemia. But of course, the ferritin is not going to be low as it would be in an iron deficiency anemia. So sideroblastic anemia can be caused by inherited causes, most commonly an X-linked condition, or it can be an acquired disorder that you can get from certain sort of drugs like chemotherapy and anti-TB drugs. Excess alcohol consumption or excess lead exposure is also known to be an acquired trigger in older adults. And in terms of managing it, so normally this is managed in the specialist supervision, and the treatments that they offer, things like pyridoxine. If you've got excess iron in the body, so iron overload, then you've got a drug called dexferoxamine, which can be used to reduce the iron levels. Treating the underlying cause is very important. And in severe cases, some patients may also undergo a blood transfusion. So I hope that was useful. It's just a short video on how to interpret a low MCV and a low hemoglobin on a blood test result. And if you did find that useful, keep an eye on our other videos on YouTube, Inspire Medics, on Instagram and Twitter, Inspire_Medics, and our Facebook revision pages for PLAB 1, PLAB 2, and the MRC GP, AKT, and CSA exams. And I'll see you on another video very soon.